And to be clear, it's not as if you have some kind of a bloated structure where you have to look for cutting costs. The fact of the matter is every growth company, whether it's AGORACOM on our side or Valeo, a pharma company, you have to build capacity in anticipation of the growth you think that's coming. So you have to undertake those capital expenditures, whether you're expanding warehouse, those operating expenditures, you're adding on new people, but you're not immediately generating the revenue yet, but you know it's coming. So I think it's fair to say that you absorbed a lot of those expenses, and you don't expect them to, you expect that SG&A to stay the same, but now what's coming is all that sales that they're there to support and optimize. So it seems like 2022 is just going to be a fantastic year, man.
Yeah, that's where we're certainly expecting that. And you're absolutely right. And that's true of almost all drugs that are launched, that there is an uptake period. The reimbursement is not always there. The fact that physicians are science-based. They want to see, they want to talk, they want to understand, they want to ask questions. They're not, and it takes some time for them, and they want to try it on patients. That's why sampling is a big phenomenon, where you give certain limited quantities that they give to their patients, and they ask their patient, how are you feeling? And especially a drug like for asthma, where, if I give you a cholesterol drug, I mean, typically you don't feel very different from one day to the next. When you take an asthma therapy, it changes your life if you see some improvement. So, this is a really key part, and all that takes time, because you can imagine that a patient that walks out with a sample is not coming back the next day to see his physician. He's coming back maybe in a month or so.
If you love that clip, give us a like, then hit the link to watch the full video. Don't forget to subscribe.